Good afternoon, everyone. My name is Cindy Clowner, and I am the Program Manager for the Ohio College Initiative to Enhance Student Wellness at Drug-Free Action Alliance, and a Prevention Specialist with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. We're thrilled that you're joining us for our webinar today using environmental scans as tools to reduce excessive drinking. We're excited to have our co-sponsored webinar with DFAA and the Higher Education Center. This year we're celebrating our 20th anniversary with the Ohio College Initiative, and we're grateful to have so many of you from around the country joining us for this webinar today. We want to encourage you to ask questions as necessary by using the question feature on the webinar, and Molly, our presenter, will be giving you some opportunities to respond to poll questions, and we encourage you to participate in those as well. After the webinar, we'll be sending a follow-up email with an evaluation as well as a Dropbox link that will have resources that Molly will be referring to throughout the session. So you'll receive copies of all of those through that Dropbox link. And with that, I'm going to go ahead and introduce our presenter, Molly Mitchell, who is the Program Manager for the Maryland Collaborative and works with Dr. Jernigan at the Center on Alcohol Marketing and Use at the Johns Hopkins Bloomberg School of Public Health. Molly oversees the daily operations of the initiative while providing technical assistance and trainings to the partner universities as they work to develop and implement interventions to change their environments that contribute to excessive alcohol consumption in and around their campus community. Molly brings years of experience consulting with local nonprofit organizations on substance abuse prevention and is a member of the Maryland Bar Association. And with that, I'm going to turn it over to Molly.
Terrific. Thank you so much, Cindy. I really want to give a big thanks to Cindy for that very gracious welcome and introduction, and really want to thank you as well for making this available to folks around the country. And so I want to thank the Ohio College Initiative and the Drug-Free Action Alliance for this opportunity. I really enjoyed giving this as a session during the conference last summer, so we're really thrilled. We put a lot of work into creating these environmental scans for colleges, and so we're really thrilled to be able to have even more colleges be able to use them and access them around the country. So I am, with that, going to get started, and I think I wanted to start really by just finding out a little bit about people's experience with using environmental scans. And so do we have the poll question available now, Cindy, or where are we going to do that?
Yes, we do.
Okay, awesome. Okay. So if you all could please just take a second and let us know whether you've ever been involved in using environmental scans before, or whether this will be something new for you. So hopefully you can see the polling question and access that. And Cindy, just let me know when it looks like we're ready to count up the numbers.
Okay. Oh, and then let me share that with you. There you go.
Okay. Okay, terrific. So it looks like about 2/3 of you almost have not used environmental scans before, but a little more than 1/3 of you have. So that's like a nice combination. I think we'll be able to cover a lot of details for folks that have used them before. Hopefully you'll still get some new information out of it. And we do have all of our environmental scans available for people to download. So hopefully these scans are scans that are going to be useful to you, even if you've already used scans before. So with that, I'm going to go on, whoops, if I can access my next slide here. There we go. So just briefly, this is what we're going to cover today. First, I want to provide a very brief overview of the Maryland Collaborative to Reduce College Drinking, just so you know who we are, what we're doing in Maryland, and how we came to develop these environmental scans for the schools we work with. And we want to define what environmental strategies are and why they're effective in reducing excessive drinking. And then we're going to describe the process that we use to develop these environmental scanning instruments to look at off-campus and on-campus environments as a way to identify environmental interventions that are going to be most effective to reduce problems in your community. And then finally, we're just going to prepare very briefly for you to go out and use these scanning instruments in your campus communities. So first of all, let me tell you a little bit about the Maryland Collaborative to Reduce College Drinking. We're really thrilled to be starting our 5th year. We were started actually in the fall of 2012, and the Maryland Collaborative was a brainchild of the then Commissioner for the State Health Department of Maryland, who came in that position with a handful of priorities for the state of Maryland, and one of those was to reduce excessive drinking among college students. He was a real visionary public health leader, and still is, and he really saw that this was a public health problem, a serious public health problem, that just the colleges with very limited resources were not able to move the needle on. He also knew that we in Maryland were really lucky to have 2 of the really national and even international experts on college drinking right here in Maryland, both David Jernigan here at the Johns Hopkins Bloomberg School of Public Health, as well as Amelia Aria, who is our partner down at the University of Maryland College Park. And they really work very well together. David Jernigan's expertise is really focusing on the environmental problems and policies that can address alcohol-related problems. And Amelia is more focused on the individual level strategies. And so together, we've really been able to work with our colleges to adopt multi-level, multi-component approaches to reducing college in their campuses. So these are our long-term goals of the Maryland Collaborative, to measurably reduce the current level of excessive alcohol use and alcohol-related harm in colleges in Maryland, and then to mobilize and sustain the commitment of campus and community leaders toward this goal. This gives you a little bit of an idea of the colleges that are involved in the Maryland Collaborative at this point. We started out the very first year going around to over 38 colleges in Maryland and asking what is the problem in their campus community, what's the nature and extent of the problem, and finding out how they thought this kind of collaborative would be able to help them in their approach to reducing the problem. We invited all of those colleges to join us, and the first year we had 10 colleges join us, and at this point we now have 15 colleges and universities around the state that are participating in the Maryland Collaborative. They are governed by a governance council made up of the presidents of each of the colleges. We learned very early on that the presidents really needed to be involved, and without that very highest level of leadership, we were going to be very limited in what we would be able to accomplish with the campuses. And as I mentioned that, I also want to really give a shout out to the Ohio College Initiative for being a leader in really, I believe they were the first state to bring together colleges across the state to look at excessive drinking and how the colleges could work together to address this problem as a group. And I was talking to Cindy a little bit before we started today about how I remember when I was working on this problem way back in the 1990s, and I was involved working at that point for the state of Maryland on the Enforcing the Underage Drinking Laws program, and going to conferences and hearing about the exceptional work that was being done at the Ohio College Initiative. And I was just really hoping at that point that at some time Maryland would be able to do something similar. I'm really thrilled that here we are, and I have the great pleasure and privilege of being able to be a part of that. So we have the presidents involved, and then we also have an advisory board that's made up of people who are really more involved on the day-to-day level in addressing this problem. So that includes the vice presidents of student affairs at each of the campuses, as well as people in the wellness centers, campus security, and we thought it was really important to bring in community members as well, because as we all know, this is not a problem that starts or ends at our campus boundaries. So we have people involved in local coalitions that are participating in the advisory board, as well as people from local law enforcement organizations that have been instrumental in helping us to pass some of the local social host ordinances that some of the campuses have been involved in. So what we found is some of the benefits of having this collaborative so far. First of all, it really raises the profile of the problem. and provides the momentum and leadership to bring other partners to the table to be part of the solution. I think that we all know that sometimes people can approach this problem of excessive college drinking with an attitude of, well, it's just always been there, it'll always be there, there's just really nothing that you can do about it. And it can certainly feel like that when each campus is trying to address this alone. But when we bring colleges together, we have found that we've been able to get things accomplished that the campuses were not able to do when acting alone. And just one example of that is passing a state law in Maryland that banned the sale of 190 proof alcohol or grain alcohol. There was a very strong leader in Maryland who had tried to accomplish that on his own at Frostburg State University and was unsuccessful until all of the presidents in the Maryland Collaborative were able to join together and were able to successfully ban that in 2014. It also provides public health expertise and support to implement effective interventions, change alcohol policies, and reduce alcohol problems. So again, I just mentioned the ban on the sale of grain alcohol. We were also, with that combination of public health expertise, able to get Maryland to extend by 2 years their ban on powdered alcohol last year, and have also been able to work to get a couple local social host ordinances passed. It provides a forum for sharing information and support among colleges statewide working to reduce college drinking. Again, I really do think there's a big benefit for colleges. They're all dealing with the same problem, and when we're able to talk to each other about what has worked in one campus and how campuses can learn from each other and support each other, that's been a really big benefit of the collaborative. And it's really been able to expand funding opportunities. So far, we've been lucky to be able to sustain our funding at the same level we started with, and in fact, we're just about to increase our funding from the state. They are really happy with the work we've been able to do working at the local level, and we're now going to be providing some additional support to some of the Maryland Strategic Prevention Framework organizations at the local level. And then, of course, it creates a standard measurement system for measuring progress. We've realized when we first started working with colleges, everybody was using a different system to measure exactly how much students are drinking. Some people had their own homemade measures. Some people were using some of the national programs, and some people weren't using anything. And so this is something we did in our very second year, is to develop a survey that we've been able to implement now every year to survey students about not only the extent of their drinking, but find out about some of the risk factors that lead to their excessive drinking on different campuses, including where they drink. Are they drinking on campus, off campus, at bars, or off-campus house parties? And what are some of the individual level factors as well? When did they first drink or become intoxicated, and what is their level of drinking? So this just shows a little bit about the different levels that we know contribute to college drinking, and I know that people on this webinar are very familiar with this, so I won't spend a lot of time, but we're really focusing on addressing the factors that lead to drinking at the individual level, the college level, and the community level. As I believe I mentioned earlier, we really feel like we need to address this as a multi-component, multi-level initiative. So we're looking at the individual level, making sure that we have screening available universally and in different places along the line once students enter college. We're encouraging academic assistance centers to consider doing some very brief screening to identify whether alcohol is a problem with students who are coming to the academic assistance centers, as well as the wellness center. At the college level, are students able to easily access the college's policies regarding alcohol use? Are they aware of the policies? We discovered with our Maryland College Alcohol Survey that a fairly significant number of students weren't even aware of what the college alcohol policies were. And are those college policies consistently enforced? If they know what the policies are, but they're not consistently enforced, students are not, they become aware of that pretty quickly. And then looking at the community level, is there a really high density of alcohol outlets just outside of the campus? And if so, are they actually carding students? Do they have responsible beverage service in place? Is there a lot of problems with parties at off-campus houses? And if so, are there things like social host laws in place? So today, we're really going to be focusing on the environmental strategies, of course, because we're going to be looking at how to use these environmental scans. So the environmental strategies look not just at the individual factors that lead to a student drinking, but looking at the context in which students are making that decision about whether they're going to drink. So context means looking at the places, the settings, the occasions, circumstances in which alcohol sales and use and related problems occur. As we all know, the environment can largely affect the likelihood of whether a student is going to be drinking or not, and that's what the environmental strategies focus on. And primarily, you'll see that the environmental scans try to collect very specific data looking at 4 primary risk factors, and those are product, promotion, price, and place. And I'm sure that this is not new to most of the people on the call. We're going to go into each of these in further detail. So first of all, looking at on-campus environments. First of all, I wanted to just find out, can we put the second polling question up? Okay. So I'd like to find out from folks whether the high-risk drinking that you see taking place in your campus community is mostly happening on campus or off campus. So think about all the different settings on campus. So students are drinking in residence halls, if there are on-campus tailgating problems, if maybe sometimes there are on-premise outlets on campus, or oftentimes there are other kind of unlicensed locations on campus where students might be drinking, and sometimes that's a certain quad near senior housing, or it could be a big green area right near a waterfront, or someplace where students kind of know it's where people go drink on campus versus off campus. So, okay, well, that's not surprising. It looks like 81% have said off campus is where your high-risk drinking takes place, and only 19% on campus, and that really is very reflective and very similar to what we've seen among the colleges in Maryland as well. When we first brought the campuses together in the fall of 2013, the first thing we asked them was, where does your high-risk drinking take place? In order for them to really choose the appropriate interventions, we felt like they needed to first identify where the high-risk drinking was happening. At that time, every single one of the campuses participating said that it was off-campus, either off-campus house parties or that there were off-campus bars that were a problem for their students. Since then, we have had a number of new colleges that have come on and said that on-campus is where the high-risk drinking mostly takes place. So we're going to be looking at both off-campus and on-campus, what some of the high-risk settings are on each of those 2 areas, and the kinds of things that the environmental scans will help you pick up. So when we're looking at on-campus environments, on-campus housing is probably the most common area for high-risk drinking on campus. And you can be looking at all kinds of things on campus. If people have posters up in their room that you can see from common areas that encourage drinking, or set a norm that high-risk drinking is a norm on our campus. Licensed premises is another place that often people look at on campus that can be a problem. We have seen that there is a lot that you can do with licensed premises on campus. A lot of campuses don't have any kind of bar on campus. If they do, actually one of the campuses that we work with that has one of the lower rates of high-risk drinking does have a bar on campus. They are able to really reduce the risk of high-risk drinking at the bar by having consistently high prices at the bar, and they find that consistently it's graduate students who drink there, and they it's not a big problem for them in terms of high-risk drinking. Tailgating is another common area for a lot of people, and this can be on campus or off campus. Other on-campus environments, well, you can see tailgating. This just shows what some of the problems can be in tailgating. Using high-risk devices and having people underage drinking. Is there some way that they're carding for students coming into the tailgating area? And again, there could be other drinking locations on campus that aren't in a bar, not on campus housing, but rather in some kind of unofficial location on campus. And another thing to look at on campus is, are there alcohol promotions? Are there promotions that include the school's logo? Are there items on campus that encourage drinking games? And of course, in the stadiums is another place where alcohol promotions can be an issue. So, which on-campus settings do you find create risk for your students? If you could just fill out that poll for one quick second, we can take a look at that. And if you could just select one that you think is your highest problem. I know that many of you may feel like you've got more than one of these, but just to indicate which one you think is most common, where the most high-risk drinking takes place in your campus. Oh, I see someone's asking me to speak louder, so I'm going to actually, I'm going to see if I can increase the volume on my phone and see if that works, or on my computer rather. Hopefully that's a little better. Okay, so again, it looks like on-campus housing is really the place where the most high-risk drinking takes place. But it's interesting to see that other drinking locations is not too far behind. And again, I'm not surprised to see that there are not a lot of problems with bars on campus. I know a lot of campuses either don't have them, or they've figured out a way to make them so that they're not really a big problem for high-risk drinking. So we're going to be looking at all of these as we go forward. Sorry, let me see how to forward my slides. There we go. And then we've got off-campus environments. So as we know, bars off-campus can be a huge problem, especially if you've got a high-density problem of bars outside of campus. And that can include all kinds of problems at bars. If there are drinking games, we had a bar near one of our campuses where they actually did a compliance check once and found that out of about 140 students at the bar, 115 of them were underage. So clearly there was a bit of a problem with that bar checking for ID. Off-premise outlets can also be a problem, and we've got a scan for those. So some of the issues with off-premise outlets, you can see some of these pictures just show signage covering the windows, and these little minis that they can be selling. So we're looking at both promotion as well as products. More signage across the windows, if there's a lot of littering outside. And special events off campus can be another problem as well. There could be off-premise tailgating that goes on in which alcohol is really readily available. Drinking games are taking place. And again, one of the biggest problem places that we've discovered with a lot of the colleges is off-campus residential parties, where drinking games can be taking place, keg stands. Are they asking for people to pay a covered charge to cover the cost of alcohol when you first come in? Alcohol promotions is another item that we need to look at with the environmental scans too. This just shows a little bit more examples of some of those. Are they selling at some of the off-campus liquor stores, are they selling ping pong balls with their beer? And why might they be doing that? Could it possibly be that they're thinking that students might want to use those for a game? I don't know. We've discovered that at least one of the campuses that's worked with us has gone to some of the outlets right near their campus and just asked them if they would stop selling that kind of paraphernalia, and they had some success with that. So here's a next poll. So thinking now of off-campus settings, can you just identify which one of the following creates the most problem for your students, which is the most high-risk setting for your students? And again, it's likely that there's more than one, but just to get a sense of where folks feel like the problem is primarily the problem in their campus community. Because each campuses certainly have a lot in common, but each campus is also a little different from the others. Okay, again, that's really interesting. It looks like about 2/3 of the folks out there say that residential parties are the place where the biggest high-risk drinking takes place, followed very far behind by bars and liquor stores and special events. So that, again, just really reflects a lot of what we've seen among our campuses as well. So I'm going to especially be talking about some of what we've done regarding residential parties, since that does seem to be a problem for a lot of folks out there. Okay. So now we're going to talk a little bit about what works. Everything that we've been looking at in our environmental scans is based on best practice. And if you want to know a little bit more about how to really learn about the best practice and the research on this, here are two really strongly recommend the Alcohol No Ordinary Commodity that goes into a lot of detail about the research and public policy around alcohol-related problems in communities, and the CDC Guide to Community Preventive Services. We have even had the WHO has identified the availability of alcohol, marketing of alcohol beverages, and pricing policies to be some of their top priorities in terms of strategies to reduce alcohol-related harm. So the research is out there, the evidence is out there that this is what really is some of the most effective strategies to reduce alcohol-related problems. So getting to the scans. Really, the scans are a great way to understand your environment in which students are engaging in high-risk drinking. And really, they can help you to identify specific actionable problems that can point you both to the right effective interventions and help you make your case more clearly for the changes that you think you need to, in terms of both policy and practice. So what is an environmental scan? An environmental scan is a form of community assessment. It's a way to really help you assess the risk factors that are contributing to alcohol use in your community. It provides you a much deeper understanding of the alcohol environments, and it provides data on context and place of alcohol use in the community. So a lot of you already clearly know where a lot of the high-risk drinking takes place, but an environmental scan is going to be able to give you a lot more detail about those environments that you can then use to identify what kind of interventions you're going to be able to adopt to really address those high-risk settings. So again, it tells you what's happening, who's doing what's the context in which the behavior is occurring, when and where is the behavior occurring, how often, on what occasions, who's involved, who knows. These are all the kind of details that can really help you make your case. For example, I'm just going to talk a little bit about the off-campus house parties, since that does seem to be a problem for a lot of folks out there. When we first brought our campuses together, off-campus house parties was really the primary locus of high-risk drinking that people identified at that point. When we looked at the strategies that or best strategies and evidence-based strategies to address settings or high-risk drinking in that setting, we found that a social host ordinance was really the best, most effective strategy to address high-risk drinking in off-campus housing. Environmental scans were able to really provide a lot of detail about what's exactly happening in those kind of settings. So for example, if you have some data about the number of, say, community complaints about problems at off-campus house parties, that can be part of your making your case for a social host ordinance. But if you've got pictures of the kinds of behaviors that take place at the off-campus house parties, as they say, a picture can speak 1,000 words, and that really is the case with some of these scans, as well as getting some of the more detailed information in the scans. So when we were putting together our scanning instruments, we looked at some of the scans that were already out there. And we realized that there's a lot of scans out there, but there were scans that were almost encyclopedic. They asked you to collect so much data about so many different points in each of these locations that it just felt like it was a little overwhelming to ask the campuses to collect all of that data. And we found that some of the data points that they were collecting weren't really actionable. So what was the point of collecting data about something that you wouldn't really be able to affect? And similarly, we found that some of the data that some of the previous scans asked for just weren't feasibly within the reach of college campuses to change. And we just, again, didn't want the process to be too lengthy and cumbersome. The real beauty of these scans is that they're pretty quick, they're easy to use, and you suddenly get a lot of data that are very useful. So again, in developing these scans, we started with a literature review and key informant interviews. And we looked at the scans for both their effectiveness and feasibility. And we looked at college surveys, and we developed our own environmental scans, really focusing in on the data that we thought it was actionable and that would be effective, and making these scans really easily usable by the different colleges. And again, we did create a program for online administration. The scans that you'll find available to you are in hard copy, they're in PDFs. What we did is we entered these questions into SurveyMonkey so that students or whoever is going to be conducting the scans can actually put this SurveyMonkey app on their phone and access the scan right on their phone. So they can be in the middle of a liquor store and, putting information into their phone. It can look like they're texting somebody, or in the middle of, an off-campus party, or wherever they are. You don't want to be in these kind of settings with a clipboard and paper and filling out information. You're going to be raising a lot of eyebrows and collecting a lot of attention that I think you don't really want to collect. So through this process, we created 9 different scans, and they covered these 9 different settings. You can see the first are on off-campus. It looks like the off-campus tailgating is down at the bottom too. So we have 5 off-campus settings: the house parties, bars or on-premise outlets, off-premise outlets or liquor stores, and then special events that could include tailgating. But we did create a separate scan for tailgating. And then on-campus housing, on-campus licensed locations, unlicensed locations, and on-campus tailgating. So we created separate scans for each of those settings because each setting is a little different, and each setting is got different data that you'd want to take a look at. So again, we really wanted to make sure that we were looking for data that would be specific, identifiable, actionable. So just to give you an example of what the benefit of using these scans can be. If you know that your students are drinking dangerous alcoholic beverages, say whether it's green alcohol or Alka-Pops or whatever it may be, if you know specifically that students are drinking new high-potency alcoholic beverages at dorm parties, that can give you an additional piece of information that you can use to actually do something about. Or you know that students are drinking on weekends with their friends. That doesn't give you a lot of really specific data that can lead you or point you to the kind of interventions that are going to be best met for whatever is going on at those weekend drinking parties. But if you know that students are hosting large parties in off-campus university housing, primarily on Friday, Saturday nights, that gives you a little bit more information that you can use to start intervening. So just initial thoughts, what are the problems and where are they occurring? This is a way to just start beginning to think about the kind of interventions that you could use to address the problems. Both, again, where are they taking place? On campus, off campus? Is it off-campus house parties? Is it off-campus bars? The date, time, and place. And then consider what the problems are and where the problems occur. And again, these scans help you to be very specific. So in order to conduct an environmental scan, again, you want to really identify what you want to get out of using that scan. So for example, if you know that you've got a bar that is a problem for your students, what exactly do you want to find out? Do you want to find out whether they're carding or not, what kind of products they're selling, what the sales are? Do they have high price sales? Do they have ladies' nights? Do they have anything that you could use to really make your case that there need to be some changes and to engage law enforcement, to go to the bar after and encourage them to change some of their practices? Or is it something about the house parties that you really want to know? Are they charging a covered charge for alcohol? Are they serving from kegs? Are they engaging in drinking games? So determine how you're going to collect the information. So this is something that is a really key point right now, because a lot of schools, wonder, how are we going to collect the information? And schools have used different people to collect some of the scanning data from different settings. So for example, a lot of times people have used some of their peer educators to do some of the scanning, both at the local bars, or again, you'd want to use students in that case who are at least of drinking age. And we also encourage people to go in pairs. You don't want to send somebody out there alone to be conducting these scans and collecting the information. If you're going into, say, a liquor store, for example, it's really good to have a pair of people going together. Have one person who kind of engages the person at the register, while another person is going through on their phone and collecting the different data points. And some of the data points in that kind of setting would be, what are the prices, what are the products they're serving. And if you start to get any kind of pushback and people are getting a little too, curious or upset with, whatever they think you're doing there, then make sure that the students know, or whoever's conducting the scans know, that they can leave whenever they start to feel uncomfortable. But determine how you're going to collect the information, and then you go out and conduct the scan, and then analyze the data that you've been able to collect. So again, thinking about exactly what kind of information, and all these questions are contained in the scans. What's going on at residential parties, what's happening in the dorms, what alcohol is being consumed, what about promotion, what are the prices. So again, we're going to be looking at both on-campus and off-campus. So there are different ways of recording your observations when you send people out there to conduct the scans. You can, before you go out, go on to mapping or GIS sites and look at how the bars or liquor stores are distributed. I think photos are a really, really great way to conduct the scans. It's just one part of the scan. It really complements filling out the questions on the scan. Just showing the kind of litter, showing some of the other images that we've seen earlier in this PowerPoint. Are people engaged in drinking games? Are there people passed out somewhere? Is somebody getting sick? One One thing I do want to make sure people realize is that there can be problems if you are taking photos. You really need to be careful not to get people's faces. Or if you're going to share that photo at all, make sure that people's faces are blurred out. And then just counting as well, how many people are at the party, how many people are in the bar, how many drinks are being served, and then as well as the forms. So all these different ways of observing and recording your observations are really important and work really well and complement each other really well. So again, you want to think about who's going to complete the scans. Is it going to be staff or is it going to be students? And there could be different reasons for using staff or students depending on the situation. For example, again, since off-campus house parties are a site that a lot of people are concerned about, I know that one of our colleges decided to send in peer educators who had been working with them, who they knew were already students who go to some of these parties and were comfortable going, and that they would be going in pairs and not drinking at the parties. Some colleges have expressed concerns about sending students to those kinds of parties if the students are going to be going into a high-risk setting, which is, of course, one reason why you want to send them in pairs and make sure that you're sending in students who are comfortable in that kind of a setting, and that they work together and identify if anybody's feeling uncomfortable at all, that they're free to leave. In some of the settings, you might feel like it's more appropriate to send staff, and that's really completely up to you and who you know you have available, and you know what's best for you. I think there's a lot of benefit to including students in the scanning process. I know that some of the students that we had conducting the scans shared with us that they kind of knew some of the theory behind environmental interventions and environmental risk factors, but it wasn't until they kind of really went out there into some of these bars with the scanning instruments and really looked for the promotions and the prices and some of the other risk factors in the bars that really kind of raised their awareness of the ways in which they were really being targeted. And then think about the times of days, the time of day and the day when you're most likely to see an accurate portrayal. So again, you're not going to want to send somebody out, obviously, on a Wednesday night to look at house parties or bars for that matter. Make sure that you're sending them out when they're most likely to see what some of the high-risk behaviors are that are taking place. And then think about who will be the person who collates the scan data. So that's going to vary from college to college. How can you scan the environment without creating a scene? And again, I think this is where if you're able to either use a SurveyMonkey app or if you've got any other kind of app that you can just insert these kind of questions into so that students can or staff can conduct it on their phones. I think that makes it a really good way of collecting the information without really standing out. And then think about ahead of time what's a reasonable timeline to complete the scans. I think that actually completing the scans doesn't take a lot of time. I think you just need to plan ahead about picking a weekend or a time when they're going to be conducted and making sure before you actually do the scans that the people who are going to be conducting the scans are well trained. So again, you'll be using the SurveyMonkey or whatever app or program that you have to conduct the scans and to just plug those questions into. And this is the kind of training that you give to the people that will be conducting the scan before they go out, is to make sure they're familiar with the scan before they go out there. And they can fill out as much information as possible before they even go to the site. So, for example, if they're looking at a bar or liquor store, there's a lot of information that they can collect just outside of the store in terms of signage and promotions. Again, try to take photos but avoid faces, go in pairs, one to observe and take photos and report information back, and one to fill out the data and interact with other people in the setting. So just make friendly conversation, ask questions, And you can also make sure that when you're conducting that kind of training beforehand, whoever's going to be conducting the scan, that they know if people start asking them questions about what they're doing, they should think ahead of time about what their answer is going to be. They can say that they're a peer educator and they're working on a project at school about alcohol prices or alcohol promotions or whatever it is. You want to be honest and you want to make sure that they've thought about that question ahead of time. So once you've gotten somebody out there and they've collected the data, analyzing the findings and sharing the results. So you want to just debrief and talk about how it went, develop a summary and what kind of conclusions and lessons learned you've come up with and how you want to follow up with that. And hopefully some of the data that you've collected can really point to some of the interventions that are going to be most appropriate to address the high-risk practices that you've seen in this, during the scanning process. These are just some of the lessons that we learned in our process of conducting the scans. We found that it really raised awareness. Like I mentioned earlier, the students who were conducting the scans became more aware, and even the people at the colleges who were training the students or the staff became more aware of the environmental risk factors that really contribute. And again, training is needed for those who are conducting the scans. You don't want to just send somebody out to conduct the scans without talking them through ahead of time how they're going to deal with different situations, people asking questions, or making sure that they go out in pairs. And it's really important to have scanners who are familiar with the environment. We had students go out in one setting where they were very familiar with the bars in that area, and it was a much better outcome than when we sent students into another town where they were not so familiar with the area, in terms of them really being able to answer questions such as, how far away are other high risks, or not high risk, but special settings like churches or schools or residential areas. And we did modify our on-campus housing scan so that, because a lot of people had some qualms about having students actually conduct those scans in on-campus housing, we have made revisions to that scanning instrument in particular so that it can be used by campus security if they are responding to any kind of incident that takes place in an on-campus residential hall. So one thing we also learned working with colleges is that sometimes, just as an example, there might be a setting where the staff at the college feel like we're not willing to go in and really conduct the scans in that setting because we have a feeling that the leadership at the college are not going to have the political will to make the changes. And one example might be if there is, say, a long tradition of having tailgating on campus, and it's something that the alumni come back for, and we know that alumni are big supporters and provide a lot of financial assistance to the school, and they like to come back for the football games and engage in that same kind of tailgating that they engaged in when they were in college, and we know that they're not going to be willing to make changes to that because it'll be too upsetting to big donors and that kind of thing. In that kind of instance, what we encourage campuses to do is to work toward incremental changes, just taking a first step by collecting the data. So all you're doing is going out there and finding out the data and taking pictures and just getting a little bit better picture of what's taking place there. And that can just begin the conversation about that setting. And that may lead to some small changes that could hopefully lead to some bigger changes in years to come. And we also found that there are times when their scans produce data that doesn't seem really very valuable. And we've discovered that can be for a few different reasons. One, maybe the setting is not a high-risk setting. So maybe you went to the tailgate area and you collected a lot of information, but all of the answers show up that there doesn't really seem to be anything wrong, and maybe it's just really not a high-risk setting after all, which is great to know. And it's great to have a scan to give you that information. Or maybe the instrument just didn't have the right questions for that setting. maybe there are some other reasons why that setting is high risk, but the scan just didn't have those questions on it. And so you might want to just keep an eye out for some things that you think might be problems that are not being collected on the scan. Or maybe the scan wasn't conducted in a robust manner, so it's possible that whoever you sent out to conduct the scan just wasn't really being completely thorough, and they weren't really paying close enough attention to what really was going on, and there were some problems happening that they just weren't recording. So that's another reason, again, to make sure that when you send somebody out to do the scan that they're well trained, and hopefully it's somebody who's really motivated and understands the purpose of these scans and is bought into the whole purpose and making sure that this is effective. So one of our PDFs that we included that are available to you is a next steps template. So I really encourage you to take a look at that template, and it asks you to just review some of the questions that we've gone over today about what are the high-risk settings, who can conduct the scan, and what are some of your next steps, and to go back and share some of that brief description of what you learned today with your peers so that this is something that actually leads to your conducting the scans. I would really love for you to conduct the scans and use these instruments. We put a lot of time into creating them. I think they really are very useful. And so I'd really love to hear it. If you do use these scans, I'd love to hear back from you. And then I'd love to hear you share just one or two things that you're taking away from this session, and how you hope to be able to use this as you go back to your offices and talk to your peers about what you think you could get out of using these scans and how you think it could help you to identify some of the interventions that you really want to implement in order to address some of the high-risk settings taking place in or off of your campus. So with that, I think we have a little bit of time for questions. I don't know, Cindy, if you've already gotten questions that people have typed in along the way, or if you want to.
We do have a couple of questions so far, but I do want to encourage anyone who has a question to enter it into the question box, and we'll field those to Molly. One of the first questions is regarding the documents that Molly is referring to and where those can be found. Those will be located in a Dropbox folder link that you will be able to access from the follow-up email that will be sent a couple hours after this webinar is completed. So in that email, you'll receive a link to an evaluation as well as a link to the Dropbox file, and all of the scans that Molly mentioned as well as that next steps template will be in that folder. Our next question, Molly, is in your opinion, how frequently should campuses be doing a scan like this?
That's a really good question. I would say it really depends on what exactly you get out of the first scan and how you follow up with that scan to determine, how often you feel like you need to go back to that same environment and scan it again. I would encourage you to, scan it a first time, see what your results are. If you feel like you didn't get valuable information, go back and look at some of those reasons why the information might not be valuable and see if there's anything that you need to tweak and do differently or questions to add and do it again. If you feel like you did get valuable information, what does it say to you? Does it give you photos or additional information that you can use to make your case for policymakers and decision makers on, say, we want you to pass a social host ordinance, or we're asking landlords to put some different leases, clause leases in their lease agreements, that kind of thing. And then if you want to go back, say, at the end of the year, if you scanned it at the beginning of the year, to see if there have been any changes that took place, either because you've implemented a new policy or practice and you want to see if there have been any changes, or maybe you haven't implemented anything new and you want to see if there's still is a problem or anything has changed since the first time you scanned.
Okay. Our next question is regarding the use of these scans in areas that only have community colleges. Molly, do you have any suggestions as to how a scan might be different, and do you feel useful information would be gathered?
That's a great question too. Thank you. We do have several community colleges that we work with as part of the Maryland Collaborative. And of course, every community college is different. And we do have a couple of community colleges that have dorms on their campus, although they, as a group, the number of students who live on campus are much less than the four-year colleges that we work with. So we've discovered that one problem that some community colleges have shared with us is that their students spend so little time on campus, they don't really see the problem the way the four-year colleges do, because students aren't coming back to campus after being out drinking, either at the parties or at the bars afterward. But there are still ways that you can find out, where students really are drinking, and you probably already have a sense whether there are, house parties or bars that are the primary problem. If you know it's a bar, I would encourage you to use the scans to go into those bars, and if you have any kind of student organization that is either interested in public health or data collection or something like a peer educator group, they could really be excited about being involved in that process. It seems like if there are off-campus house parties, you should be able to do the same thing. But again, it does, the one thing I have seen with the community colleges is that it's much more likely to be off-campus than the four-year colleges. So I hope that answers the question.
Thank you. Another question, how were college presidents approached, and what was the selling point for getting them on board?
That's another great question. Well, when we first reached out to the colleges, we went first just to listen, to find out what the problems and the nature extent of drinking was on their campuses and how they thought this kind of collaborative could really be useful to them. We were very sensitive to the dynamic of not wanting to come across as, we're the experts from Hopkins or Maryland and we're here to tell you what to do differently. We really wanted to make sure that we were very sensitive to the political nature of this. A lot of colleges, I think, were a little skittish at first because this is a very tricky issue politically for them to be willing to share the information about the extent to which their students are drinking, the extent to which they have transports. Just having their students complete that annual college survey was really a big act of trust. And so we were sure that for the campuses who did join us that we were keeping all of that information confidential. But when we first reached out to the campuses, it was an invitation from our campus president, President Daniels at Johns Hopkins University, as well as the chancellor at the University System of Maryland. And it was an invitation from them to their peers asking them to join in this effort. And we did, when we first reached out to President Daniels at Hopkins, have the state health commissioner who really first started funding this project join with us in setting up a meeting to discuss this with President Daniels so that he was on board from the very beginning. So I think that having the state health commissioner and President Daniels from Hopkins on board at the very beginning really helped to bring the other presidents on board as well.
Great. Well, Molly, I think that wraps up all of our questions. I would like to thank all of you who were in attendance with us today, and a special thank you to Molly for presenting for us, sharing her expertise and all the wonderful resources and scans. Again, those will be accessible to you by Dropbox link that will come to you in an email a couple of hours after the webinar concludes. Additionally, in that email will be an evaluation that we encourage you to give your feedback to, and a link for a recording will be available as well if you have colleagues that may be interested in watching the webinar now that it has been completed. So with that, a final thank you. I hope you enjoy the rest of your Wednesday afternoon.
Okay, thank you, Cindy. Thank everybody for joining.